April here from Pelvic Balance. I want to show you how to assess scar mobility. I work with a lot of women who have had C-sections, and it's very important for us to see how the scar is moving and reduce the formation of excessive scar tissue. Now, you can do these techniques on any scar, really. So what you'll do is you want to assess the mobility of the scar from all directions. So here's my fake scar here. So what I do is I put my fingers right on the scar and a little bit of pressure, and I slide my fingers up and down and move right along the scar. Now, before you do any scar massage, you want to make sure that that scar is completely closed and there's no scabbing whatsoever. But you use gentle pressure first. So it's not like your fingers are just sliding over the tissue. You're applying pressure to see how much of the slack can you pick up from the tissues. And you just move in all different directions. There isn't, a special way that you have to go, like you have to do up and down first, side to side. No. Just making sure that you assess all directions. So I'll move along the scar, right over it to see how my fingers move. I'll go side to side to see how my fingers move. And the way you can determine how that mobility is, if you go to move your fingers, say, in one direction and the tissue moves pretty well, but then you try to go the other direction and you can't really slide your fingers, that sort of tells us, okay, there might be a little restriction there that we need to work on. Now, sometimes you can also get a feel for how the scar tissue is by just looking at a scar. And if there's puckering of the scar, that will often indicate that there's some excessive scar tissue formation that's happening under the surface. So that's something that we like to address because it can impact a lot of the other tissues, sometimes other organs. If it's like an abdominal scar, for example, it can really affect a lot of things. So we definitely want to address that. So you'll go right over the scar, all different directions. You can do little circles, clockwise, counterclockwise. You'll want to go to each side of the scar too and check all those directions. So you're getting a feel for how the tissue is all around that scar. And that will help you determine if there are areas that you need to work on. The other thing that's good to do is to try to lift the tissue. So you try to, sort of do a gentle pinch of the tissue right between your fingers there and see, okay, maybe this area I can grab a lot, this area, maybe you can't grab it at all. Again, that gives us information. And then you'll want to pinch this way too along the scar. So, again, there isn't like this perfect pattern to doing this. It's just getting a feel for how that scar moves, and then it lets us know what we need to work on. I hope that helps. Let me know if you have any questions. You can reach me, April, at pelvicbalance.com. Thank you. Have a great day.